Good afternoon, everyone. So my name is Katie Lawson, and I am the Research and Innovation Lead for the Independent Anti-Slavery Commissioner, Dame Sarah Thornton. I'm really delighted to be here and to have an opportunity to set out how and why getting value from research and innovation is a priority for the Commissioner. So I'll just very briefly outline the role and remit of the Independent Anti-Slavery Commissioner for background. So the role was established by Part 4 of the Modern Slavery Act 2015, and it comprises a UK-wide remit to encourage good practice in the prevention, detection, investigation and prosecution of modern slavery offences and the identification of victims. And the Commissioner has published a strategic plan for the period 2019 to 2021 with 4 priorities: getting value from research and innovation is the 4th one. The first 3, just very briefly: improving victim care and support, supporting law enforcement and prosecution, and focusing on prevention. Back to research and innovation, as part of the Commissioner's legislative remit, there is a clause within Part 4 of the Act that sets out that the Commissioner can undertake or support research which can support her functions. And it's also worth noting, what I always think is really interesting, the original bill, when it was introduced into the House of Commons in June 2014, provided for an anti-slavery commissioner without independent listed in the role or within the functions. And it was only following some bill committee discussions and debates that the role was amended to include independent. But it's really essential that the activities of the Commissioner are rooted in independent, impartial and objective evidence-based reflections and recommendations to government, to statutory bodies and to stakeholders across the sector. So why did we embed getting value from research and innovation within our strategic plan? So we recognise that there is a vast amount of research taking place on modern slavery, and there's an incredible passion across the sector by academics and by other evidence creators and users. I think the term is broader than that, just academics. The passion they have to better understand modern slavery and respond to it, and to try to understand the conditions that facilitate exploitation. So our focus has been to help bridge that gap between research, policy and also practice. And we're really keen to ensure that research is usable and that it informs and shapes policy making, and also embeds the expertise of practitioners and survivors. Survivor-led research, as Olivia was mentioning earlier, really should be supported. One interesting approach that we've seen, just to illustrate, has been work by the NGO Focus on Labour Exploitation, FLEX, to use feminist participatory action research, FPAR, on the experiences of women who are working in precarious labour in the UK. And a need for more collaboration across evidence users and creators was a key finding of a report that we published last year on the impact of survivor support research on policy. And this was written by Dr. Giuliani Rinaldi-Semione, who's here at the conference. The report's called Preparing for Impact: How we can overcome barriers and cultivate a culture of collaboration, understanding and respect to achieve impact on survivor support. And Dr. Rinaldi-Semione was actually conducting a placement with PaCCS in our office at the time, so it was a really highly valuable opportunity to try to bridge that gap between research, policy and practice. I'll just quickly make some comments on evidence and data. So ensuring research, evidence and data can inform policymaking practice on modern slavery requires some work to share research in an accessible way and to translate research into impact. And I recognise that this is a real challenge in practical terms for academics. There's a pressure to publish work in academic journals. They're often behind paywalls, and it's only accessible to other academics. But as I mentioned earlier, evidence users is a bit broader than that. We've actually just concluded a call for evidence on practitioner work to respond to child exploitation. And we want to identify how practitioners use and share good practice, promising practice in this space. And modern slavery is really complex, and understanding the scale and nature of the different typologies of exploitation and how modern slavery affects individuals, communities and society is really critical. In our work on practitioner responses to child trafficking, we're looking at approaches that incorporate the views and experiences of those with lived experience, And we're also looking at alternative approaches to safeguarding and prevention. So, for example, contextual safeguarding. Our office has also conducted work to examine what a public health approach to modern slavery might look like. We're also currently supporting a rapid research project on re-trafficking to try to understand the evidence base on this. And we ran a call for evidence as well. And we found that, unsurprisingly, there's a real lack of data recorded on re-trafficking. But actually, what was even more important was that there is a lack of consensus on how re-trafficking is defined in policy and in practice. And without consistency in terminology, how can we really collate and examine data to inform our policies? We're really interested as well in understanding established and emerging estimates on modern slavery and prevalence estimates. We know that the complex nature of modern slavery makes it really hard to quantify, but it's really important to recognise that these estimates do inform policymaking, and they do inform public perceptions and media reporting. We really need good access to qualitative, quantitative data and evidence, and longer term research, systematic reviews, gap maps, evaluations. They're all really essential to ensure at the end of the day that survivors are supported by policy that's rooted in evidence. And just finally, to note that we have recently published some research priorities. I'll share a link in the chat. We looked at where are the evidence gaps in our 4 priority areas, so longer term victim support, law enforcement and criminal justice picture, and what works in prevention, and also the business response to issues such as trafficking and supply chains. So, for example, what works best to support victims and survivors to their longer term recovery, for example, whilst they're in the NRM? We looked at the benefits and barriers of access to work for victims and survivors within the NRM, and produced a report with some practical recommendations to government and to service providers on how to provide options to people whilst they're in the NRM on training, education and work experience. So our research priorities, they build on those that have been developed earlier by the Home Office, also by the Modern Slavery and Human Rights Policy and Evidence Centre, and we welcome work in any area of research gaps that have been identified by our office and by others as well. I think I've probably come to 7 minutes, so thanks very much for your time, everyone, and I would welcome any questions or clarifications.